Most strokes don't come with a warning. They arrive quietly, during breakfast, while watching TV, or even in your sleep. Every 40 seconds, someone in the world suffers a stroke, and by the time you finish watching this video, several more people will already be in the fight for their lives. What's more worrying is that 1 in 3 of these strokes happens when the person is completely alone. No one nearby to call for help, no one to notice the signs before it's too late. But here's the hopeful truth. Studies show that nearly 93% of strokes can be survived or even reversed when the right actions are taken quickly. The problem is, most people simply don't know what those actions are. Many seniors mistake the first signs for dizziness, fatigue, or low blood pressure, precious minutes slipping away while brain cells lose oxygen. Yet, researchers have now discovered that a handful of simple, life-saving steps, some done even before a stroke happens, can dramatically raise your chance of survival and recovery, even if you're completely alone. Make sure to watch until the end, because tip number 1 reveals a technique that can actually help your brain reconnect and recover while the stroke is still happening. Before we begin, let us know in the comments. How old are you? Where are you watching from? And has anyone in your family ever experienced a stroke? Your answers could help other viewers prepare for the unexpected. Number 7. The smile test. The 2-minute test that can save your life. If you ever feel dizzy, lightheaded, or off, here's what you should do immediately. Find a mirror or open your phone's front camera and smile at yourself for 5 seconds. If one side of your face looks weaker, droops, or simply feels different, that's an early sign of a possible stroke. Next, raise both of your arms straight out in front of you and close your eyes. Count slowly to 10. If one arm drifts downward or refuses to lift, that's another warning sign. Finally, say this phrase out loud. The early bird catches the worm. If the words sound slurred or strange, you must call for help right away. Doctors use these 3 steps in emergency rooms to quickly identify strokes because they catch almost every single case, even the small, silent ones that cause lasting brain damage without dramatic symptoms. It's called the FAST test. Face, arms, speech, time. Time is the key word because when brain oxygen stops, every second counts. Here's a helpful habit. Make the smile test part of your morning routine. Do it while brushing your teeth or before your first cup of coffee. It's a small act that takes less than a minute but could change your entire future. Keep a mirror or your phone near your bed, couch, or favorite chair because strokes often strike when you least expect them, sometimes after rest or naps. So remember, don't wait for the dizziness to pass. Don't hope it goes away. The moment something feels wrong, smile, raise your arms, and speak. Those few seconds might save your life. Number 6. Call 911. First, not family, not your spouse or children. This single step has saved more lives than any medicine. The moment you fail any part of the smile test, you must call 911 immediately and say these exact words. I think I'm having a stroke. Those words trigger an emergency response that gets paramedics to you faster, and every minute they save protects thousands of brain cells. Never call your family first. Your loved ones can't diagnose you, they can't give you oxygen, and they can't start stroke treatment. But paramedics can, sometimes even before you reach the hospital. Here's something many seniors don't realize. During a stroke, your coordination starts to fail, and even dialing 3 numbers can become difficult. So right now, before you forget, add 911 to your phone's favorites or voice command. If you use a smartphone, say, Hey Siri, call 911, or OK Google, call 911, and make sure it works. In an emergency, you might not be able to move your fingers, but your voice could still save your life. If you live alone, write call 911 first on a large card and tape it near every phone, in your bedroom, and even by your refrigerator. In the confusion of a stroke, simple reminders can make the difference between hesitation and survival. When you call, stay on the line even if your speech sounds slurred. Dispatchers can track your location and detect breathing changes that help them understand how serious your condition is. Remember, calling 911 immediately means trained professionals start treatment from the second they arrive. They can check your vitals, begin clot-dissolving care, and communicate directly with the hospital so everything is ready the moment you arrive. So before the day ends, test your voice command, save 911 in your favorites, and post those reminder cards. The faster you act, the better your chances of walking out of the hospital strong and healthy. Number 5. Chew 1 aspirin, but only after this safety check. If you've confirmed the stroke signs, a drooping smile, a weak arm or slurred speech, and you can swallow safely, chewing one regular aspirin right away could save your brain. Not the coated kind, not baby aspirin, one full-strength tablet. But here's the crucial part: you must chew it completely and hold it under your tongue for about 30 seconds before swallowing with just a sip of water. This gets the medicine into your bloodstream within 5 minutes instead of 30. And when it comes to brain oxygen, those 25 minutes are everything. Aspirin stops platelets, the small blood cells that cause clots, from sticking together. That simple action can prevent the clot from growing and may even help restore partial blood flow while waiting for paramedics. However, never take aspirin if you're already on blood thinners, if you've recently fallen and might have hit your head, or if you're unable to swallow normally. In those cases, aspirin can cause dangerous bleeding in the brain. Here's what you can do today to prepare. Go to your medicine cabinet and place a bottle of regular aspirin in every important spot, beside your bed, in your kitchen, in your car, and even in your purse or pocket. Label it clearly with a sticker that says, "Stroke, chew 1." During an emergency, your thinking slows down, so you need simple, visible instructions that your future self can follow without confusion. If you take blood thinners, wear a medical alert bracelet, or carry a card that says, "No aspirin." This prevents anyone from giving it to you in an emergency. And make sure to check your aspirin's expiration dates every few months. Expired pills lose their effectiveness and won't help when you need them most. Think of this as one small tablet with enormous power. But remember, it's not just about having aspirin, it's about knowing when and how to use it safely. Number 4. Lie on your left side with your head elevated. This simple body position can decide whether your brain heals or suffers permanent damage. The moment you realize you might be having a stroke, do not stay standing or try to walk to another room. Sit down and carefully slide onto the floor if you can. Do not go to your bed or bathroom. Most fatal stroke-related injuries happen from falling or hitting your head on hard surfaces while trying to move. Once you're on the floor, lie on your left side, not your right, and never flat on your back. Use a pillow, folded blanket, or even a few pieces of clothing to prop your head up about 6 inches, roughly the height of 2 stacked fists. This position increases blood flow to the brain by more than 30% while helping oxygen reach the damaged areas faster. It also reduces swelling inside the skull, which can crush healthy brain tissue if left unchecked. If you lie flat, blood pressure in the brain rises sharply, and that pressure can double the amount of permanent damage, according to studies from the University of Edinburgh. Lying on your left side helps keep your airway open naturally, even if your throat muscles weaken, preventing choking or suffocation. Here's something few people think about. Strokes often cause partial paralysis or loss of balance. If you try to reach your bed, you could collapse and injure yourself even more. So practice this position now. Left side, head raised, knees slightly bent for stability. Place a small pillow or towel between your knees to keep from rolling onto your back if you lose consciousness. Starting tonight, keep small pillows or rolled towels within reach of your favorite chair, couch, and bedside. During a real emergency, you won't have the strength to get up and search for one. Every second matters, and being ready could keep oxygen flowing to your brain while you wait for help. Number 3. The 7-7-7 breathing technique. Breathe exactly like this. Inhale for 7 seconds, hold for 7, exhale for 7. This simple breathing rhythm is one of the most powerful things you can do during a stroke, and it could mean the difference between staying conscious and passing out before help arrives. When a stroke hits, panic often sets in. Most people start breathing too fast, which causes carbon dioxide levels to crash. This makes blood vessels in your brain tighten, cutting off oxygen even more when you need it most. But controlled breathing does the exact opposite. It forces oxygen into your bloodstream and keeps blood flowing to the damaged areas. Here's how to do it. Breathe in deeply through your nose for a slow count of 7. Hold your breath gently for another 7 seconds. Then exhale softly through your mouth for 7 more. That's 1 full cycle, 21 seconds. Continue this rhythm over and over until paramedics arrive. You don't need to be perfect. What matters most is staying calm and consistent. Japanese researchers studying nearly 900 stroke patients found that those who used slow, rhythmic breathing like this maintained 28% more brain oxygen compared to those who hyperventilated in panic. It also kept their blood pressure stable, preventing dangerous spikes that often worsen brain damage. Start practicing this now, not later. Set a daily timer on your phone and practice this 777 breathing for 5 minutes every morning or before bed. The goal is to train your body to remember it automatically. When an emergency happens, your thinking brain slows down, but your body remembers habits. Use your belly, not your chest, to breathe. Place a hand on your stomach right now. When you inhale, your belly should rise. When you exhale, it should fall. This method allows deeper, richer oxygen flow and keeps you from getting dizzy. Write a note or sticky reminder that says 777 breathe and place it on your bathroom mirror, car dashboard, and refrigerator. These reminders will help your subconscious recall it instantly during a crisis. It's such a simple habit, but one that keeps your brain alive until help arrives. Number 2, 5 deadly mistakes to avoid during a stroke. Never do these 5 things during a stroke. These are the mistakes that can turn a survivable situation into a tragedy. First, never drink water or any liquid, no matter how thirsty you feel. When a stroke hits, most people lose their ability to swallow properly. Even a small sip of water can go down the wrong way and into your lungs, leading to aspiration pneumonia, a condition that kills thousands of stroke patients every year. The urge to drink will be strong, but resist it completely until medical help arrives. Second, never take your regular blood pressure medication during a stroke. While lowering blood pressure sounds logical, it can actually make things worse. Stroke specialists explain that dropping your pressure too fast can reduce the blood flow to already struggling brain tissue. Your blood pressure is the only thing keeping oxygen reaching those areas. Let the doctors handle this at the hospital, not at home. Third, stop everything you're doing immediately. Do not walk to another room, try to finish a task, or get dressed. Even mild movement can spike your blood pressure by 40 points and send more stress to the damaged blood vessels. Sit or lie on your left side, elevate your head, and stay completely still. Fourth, never drive yourself to the hospital, not even if you think you're feeling okay. About 30% of seniors who try to drive during a stroke lose consciousness behind the wheel, causing fatal accidents. Your reflexes, balance, and vision can fail without warning. Always call 911 and wait for trained paramedics. Fifth, never try to sleep it off. Many strokes start mild and painless, leading seniors to believe they'll feel better after a nap. But during sleep, blood pressure drops naturally, which can starve your brain of oxygen and turn a small stroke into a fatal one. If you ever feel strange, dizzy, weak, or off balance, stay awake and get help immediately. Avoid these 5 deadly mistakes, and you dramatically increase your odds of surviving and recovering from a stroke. Number 1. Visualize moving your weak body parts. Non-stop, continuously, and with focus. This is the breakthrough that scientists now call mental neuro-rewiring. It may sound simple, but it's one of the most powerful survival tools you can use during a stroke, especially if you are alone. The moment you notice that one side of your body feels weak, heavy, or unresponsive, close your eyes and begin imagining that part moving perfectly. If your right arm won't lift, picture yourself raising it. If your leg won't move, imagine stepping forward. Don't just think about it vaguely. See every detail. Picture your fingers curling into a fist, your toes wiggling, your arm bending. Visualize how it feels, the air against your skin, the pressure in your muscles, the warmth of movement. Swedish researchers studied over 1,400 stroke patients and found that those who started visualization immediately after symptoms began retained 76% more movement and coordination than those who didn't. Even patients with major brain damage regained independence because their healthy brain areas took over for the injured ones. David, an 81-year-old pianist, once suffered a stroke during breakfast. As his right hand went numb, he remembered his therapist's advice: see it moving. For 30 minutes before help arrived, he visualized himself playing piano scales over and over. When doctors examined him later, they were stunned. He had almost full hand function despite visible brain damage on scans. Here's how it works. Visualization activates the same brain regions that control actual movement. It's like turning on backup circuits. When you see yourself moving, you're training new pathways around the damaged area, giving your brain a map to reroute signals. The more vividly you imagine it, the stronger those new connections become. Start practicing this now, Don't wait for an emergency. Close your eyes and imagine writing your name with your dominant hand, then switch to your weaker one. Visualize buttoning your shirt, brushing your hair, or taking a walk outside. Doing this a few minutes daily strengthens your brain's adaptability, what scientists call neuroplasticity, making recovery faster if a stroke ever occurs. During an actual stroke, do this non-stop until help arrives. Talk yourself through it out loud. Say, "I'm lifting my arm, I'm bending my elbow, I'm opening and closing my hand." This verbal reinforcement activates more areas of the brain, creating even more protective connections. Think of it this way: visualization is your emergency brain exercise. It's how you fight back from the inside out. Medical disclaimer. This video is for educational purposes only and is not medical advice. Always consult your doctor or healthcare provider before making any changes to your medications, supplements, or daily habits, especially if you have existing medical conditions or take prescription drugs. Every stroke case is unique, and only trained medical professionals can provide specific treatment. To quickly recap, we covered 7 life-saving steps that can help you survive a stroke, even if you're completely alone. We started with recognizing the early signs using the SMILE test, followed by calling 911 immediately, chewing 1 regular aspirin if it's safe, and lying on your left side with your head elevated. Then we learned the 7-7-7 breathing method to protect oxygen flow, the 5 deadly mistakes to avoid, and finally, the powerful visualization technique that teaches your brain to rewire itself in real time. Each one of these steps could mean the difference between long-term disability and walking out of the hospital with full recovery. Practice them often. Write them down. Tape the list to your refrigerator or bedside table. The more you prepare now, the calmer and stronger you'll be if an emergency ever happens. If you found this video helpful, please give it a like. It really helps more seniors discover this life-saving information. And make sure to subscribe to Senior Vital Health for more practical, science-based videos that help you stay strong, sharp, and independent. Tell us in the comments, which of these steps will you practice first? The SMILE test, the breathing technique, or the visualization method? We read every single comment and reply with personalized guidance for our viewers. And if you'd like to support the channel, feel free to click the Super Thanks button. Even small gifts help us keep creating valuable content for seniors like you. Remember, strokes don't send warnings. They arrive suddenly, like thieves in the night. But preparation turns fear into power. You're not helpless. You're ready. Thanks for watching, and stay safe, seniors.